Good, good, not good. Sure, check 1, 2, 3, 4. I'm told when you're the governor you can start early. All right? Good? All right, good afternoon, everybody. We are excited to finally be here in Covington to celebrate the opening of this COVID-19 regional vaccination clinic. We have planned to be here last week, but Mother Nature made up her own mind and had her own plans. We've now weathered 3 strong winter storms in rapid succession. I want to remind Kentuckians everywhere that you still need to be cautious on your roadways, and you need to continue to check on your family members, your neighbors, and your friends. We have weathered 11 months of a pandemic. We don't want to lose anybody else to this winter storm. So make sure people are safe. Make sure if they are using a generator, it is not in their garage and it is not close to their home. Make sure that we are checking on one another and doing what we do so well, looking out for our fellow Kentuckians. I want to offer thanks as well to our amazing road crews, our National Guard that has been out there in many areas of the state, clearing our roadways, and everybody who has made sure that all of our infrastructure is not only open, but as safe as we can make it. It is tough work in these cold temperatures, and they've been at it for many long days. That's the same grit matched with compassion that we are seeing at vaccination sites like this all over the Commonwealth, where we are finally administering this safe and effective modern medical miracle that are these vaccines. I want you to think about something for just 1 minute. We had our first case of COVID in Kentucky on March 6th of last year. That means that in Kentucky, this pandemic isn't yet 1 year old. Yet here we stand with 2 effective vaccines and 1 on the way, with 550,000 plus Kentuckians having received at least their first dose of the vaccine, over 12.5% of our population vaccinated. We are not out of the woods yet, but that is a heck of a start. And it shows the progress, the resiliency, and what I think is the optimism that we can begin to feel. We're here at the Northern Kentucky Convention Center in Covington, where downstairs our heroic healthcare workers are administering COVID vaccines as part of our commitment to bring this shot of hope to every area of Kentucky. We are committed to an equitable and just rollout of this vaccine where you don't have to spend a whole day trying to drive 3 or 4 hours away just to have the vaccine administered to you. I want to thank the administrator and workers at this Northern Kentucky Convention Center. They have been a great Team Kentucky community partner throughout this pandemic. They've done a lot in this building. They've hosted unemployment insurance office appointments, and they've allowed social service agencies to set up emergency homeless shelters. They've been here in people's time of need, and now they're here to provide them that shot of hope. Those efforts help people of Northern Kentucky and have helped the entire state stop the dangerous spikes we face now 3 distinct times in our battle. And they have stepped up once again to host this regional vaccination clinic, which in a little over a week, even with 1 day postponed, has already administered more than 2,400 doses to Kentuckians. And I can tell you, I saw just a small part of those more than 2,400 walking through today. First time I think anybody's ever been really excited about getting a shot. But everyone thrilled at this opportunity to see past what has so consumed us these last 11 months. Another key partner in our long fight has been Kroger. From the very beginning, they have been one of our most important partners. Very early in this pandemic, we sat down with them to address testing. You may remember when I announced the first case, we had very little testing in this state. We had 1 lab that could process it, and we were having to ask people to wait. But we said we looked forward to the day when there was an opportunity for anyone who wanted to get tested to get tested. The state, working with Kroger, was able to make that happen, creating such efficient drive-through testing sites that they became the national standard and are now what the U.S. government uses in surge testing all across the country. Now they're helping us build out the infrastructure to get these vaccines in as many arms as we can in Kentucky as quickly as we can. It was just 2 weeks ago that Kroger helped us open our first regional site at the Kentucky Horse Park in Lexington. Since then, along with other partners, we've announced over 150 vaccination locations across Kentucky. We're getting better and we're getting more efficient every single week. That brings us to the main concern that I have facing us right now: supply, supply, and supply. If you've toured downstairs, you see a facility that is ready, able, and willing to administer a lot more doses than we currently have. Now, the last 4 weeks have been good to us. The federal administration has increased the doses to our state program 57%. We've gone from about 53,000 to 83 to 87,000 doses a week in that program. It was just announced that the federal pharmacy program is being doubled. That'll take us from about 18 to about 36,000 doses coming in that program. And we have a couple other federal programs that are out there. So that's good. That means we have over 100,000 doses coming in every week, but we know it is not enough. What you are seeing here is us building towards the future, knowing that we are going to have significant more supply that comes in at a later date and not waiting to build out our ability to administer it. If we get that significant supply increase, we expect in March, and then what we expect a very large one as we move in towards June, depending on when Johnson & Johnson is approved and when it ramps up. We don't want any waiting or any lag time. No matter how much they give us, we want to be able to get 90% of it in people's arms in just that first week. Again, we are putting these shots in people's arms faster than the federal government can get us doses. To date, more than 555,000 Kentuckians have been vaccinated in just over a month and a half. Right now, the vaccine appointments are limited because supply is limited. So we are in what we call Phase 1B, where we are prioritizing Kentuckians 70 and older. We're asking all vaccination sites to prioritize this population until further notice, but all 1A individuals, healthcare workers, those in long-term care, and 1B, child care workers, teachers, those over 70, and first responders are eligible at the moment for vaccines. As vaccine quantities and available appointments allow, people in Phase 1C may also be scheduled for appointments. As we have now over 150 vaccine locations out there, it's important to have one place to be able to go to get the information. That's why we launched vaccine.ky.gov, which will show you all the locations and how to sign up. Also a hotline, 855-598-2246. And for the deaf and hard of hearing community and that community alone, we don't need to flood this line, 855-326-4654. Until supplies increase, it's going to take some time to get everybody their shot of hope. And we know how badly people want it. So this patience that we're asking of Kentuckians and Americans is a lot to ask. But we know it's achievable because we have seen people show this patience and this kindness and this compassion throughout this pandemic, making sure those that are most vulnerable or could be harmed the most have that first place in line to make sure we get them the protection that they need. We're also committed to a fair and equitable distribution. It shouldn't matter if you live in Covington, Bowling Green, Louisville, or Pikeville. If you want a vaccine, you should be able to get it in your region, in your area. We also know it shouldn't matter the color of your skin or what social or economic status you may hold. When it comes to getting a COVID vaccine, we are all equal, and we need to ensure that some of the historic inequities do not occur in this vaccine rollout. Folks, we are at a historic place in time, defeating a 1-in-100-year pandemic. I believe now is the time to ensure that for once we do this right, that everybody matters, and that if we can do this right in an equitable way, we'll have done just one additional step to making this world a better place and proving that there is a better tomorrow. Regional vaccines like this ensure that we are giving these life-saving medicines to our people where they live. While today is one of optimism, actually, if you go downstairs, it's one of joy. Visiting these sites is a moving experience where you feel purpose and hope and relief and so many emotions all at the same time that it's really hard to describe them. We know one of the reasons that we feel all those things is the grief and the difficulty that we've endured these last 11 months. And everybody's endured it in their own way. Many of us have lost people that we love and that we care about. Some families have been hit especially hard. All of our lives have been turned upside down, and we worry. We worry about paying the bills. We worry about our parents seeing their grandkids and getting to hug them again. We worry about our communities and about our future. It's been tough, and it's created anxiety. We need to take a moment to realize we've lost over 4,300 Kentuckians to this deadly virus. It's more than we lost in World War I, Vietnam, or Korea. This has certainly been the war of our lifetime. And we remain in a very dangerous place where we have to continue wearing masks. We have to continue practicing social distance. We have to continue following all the rules and regulations we have in place, and we have to continue making sacrifices. Even though we know that victory is in sight, we know that we got to protect everybody around us until we get there. The light at the end of the tunnel is growing ever brighter. And right here, today, in this place, you can see it more clearly than ever. But make sure that we protect one another until we're all the way out of this tunnel, into that sunlight. It's 70 degrees outside, and we can all take off our masks at that point when we're all safe. Getting to that time, getting to that light, we could not do without partnerships like ours with Kroger and the compassion of everyday Kentuckians that help us to get through. We will get through this, and we will get through this together. God bless you. God bless the Commonwealth. And now I got a special opportunity to introduce a leader who has been just such an incredible partner. We wouldn't be here today without him. I'm going to introduce him like he says he introduces himself. Let me introduce you to Rodney, who works at Kroger.
Thank you, Governor, and thanks everyone being here. Governor, everything that you and your team have been doing over the last almost year now is just incredibly impressive. And getting Kentucky through this and then setting the foundation for across the U.S. And everybody is forever indebted to you and your team and everyone, so appreciate all that you've done. Before I talk a little bit about what's happening today, I did want to mention just briefly to acknowledge everybody in Texas. And I realize we're in Kentucky, and we all love Kentucky dearly, but when you think about everything that's going on in Texas right now with the power outages from the recent storms, and our thoughts are with everyone in Texas. A huge thank you to Kroger Associates in our Dallas and Houston markets. They're doing everything they can to stay open, serve the communities, and be able to serve everybody with access to fresh food, just like what we do everywhere. And when you look at the event today and look at all the things that our teams have done across Kentucky as well, we would not be able to do any of that without the partnership with the governor. The National Guard is just amazing. Hopefully you've had a chance to walk around a little bit downstairs, but this just wouldn't happen without the National Guard. And as soon as I got here, the very first comment the Kroger team made to me is, the National Guard's just amazing. The city of Covington's amazing, And the Kentucky State Police has just been incredible in terms of everybody working together to make the operation downstairs incredibly efficient, getting through as many people as we can. If you followed Kroger, you know Kroger's purpose and vision is to help people live healthier lives. And when you think about what's going on downstairs right now, that's what's happening. Our teams are able to help people have a better life, get back into the normal swing of things, being able to hug things. I was on an interview the other day and somebody asked me, what did I miss the most? And I said, handshakes, high fives, and hugs. And all of us want to be able to get back to where we can start doing those things again with those we care about and those we love. And when you look at what's happening downstairs, that's what's happening downstairs. As the governor said, you know, downstairs, we've been able to vaccinate over 2,500 people. If you look at, for Kroger, over the last week or so, couple of weeks, we've been able to vaccinate over 14,000 people. If you look across the U.S., we've now been able to vaccinate over 400,000 people. I am just so proud of our Kroger Health team. And when you talk to our team, they are so proud of being able to help people stay healthy and get back in their normal daily lives. And one of the things that we announced this week is a new scheduling system. The governor talked about the scheduling system across the state of Kentucky, but we upgraded our scheduling system to try to make it very easy. So we can schedule 250,000 people, but those are things that we're all doing, working together to try to make it really easy for people to get scheduled. And that new system, people can schedule their first appointment and their second one and be ready to go. We also announced our own vaccination support call center for anybody that doesn't have easy access to the internet as well. And as always, I'll end where I started. Thank you for being here. Thank you for everything that everybody is doing, trying to help people stay safe, reminding people wear a mask, wash your hands, and all those good basics, and stay 6 feet apart when you're in our stores. And in the back of the room is Scott Hayes, who's president of our division here in Cincinnati. And Scott and his whole team has just done an incredible job working with the state of Kentucky. So Scott and team, thank you for all you're doing. Governor, thank you for all you're doing, and I'll turn it back over to you.
Want to make sure I recognize two state representatives we have here today, Representative Wheatley and Representative Roberts, who are doing a phenomenal job in Frankfort, working to represent and protect the citizens of Northern Kentucky. So one thing that we absolutely see in fighting this pandemic is it takes action. Action is necessary, inaction is deadly. In places that have refused to make tough decisions, in places that have just hoped that it will go away, we've seen devastating consequences. Action is one of the reasons that Kentucky is in the bottom 10 per capita in deaths in the United States. It means we're one of the top 10 states in protecting those around us. That's not just decisions made on the state level. It's action taken on the local level. So next I get to introduce Covington Mayor Joe Meyer, who has been a person of action, who has made sure that here in Northern Kentucky we're doing what it takes to protect our people and has been involved every step of the way. We appreciate you, and we got a lot more people up here that are around because of your leadership. Mayor Meyer.
Thanks, Governor Beshear, and good afternoon, everybody. On behalf of the people of Covington and indeed all of the people of Northern Kentucky, I can't tell you what a sense of gratefulness and relief that we have that this mass vaccination center is open. It gives hope that we're seeing the end of this pandemic. We have already gotten a lot of feedback about the way this center is being operated, and all of it is very, very positive. It's well run, it's smooth, people are in a very positive, supportive environment, so it's a kind of place that you'll once you've been here, you'll actually want to come back to make sure you get that second shot. Organizing the type of response that we've had to the coronavirus in Kentucky is no simple challenge. We all understand and recognize the complexities of it. It's not possible to do what's been done here in Kentucky without incredible leadership. And we have to recognize the contribution and the leadership of Governor Beshear for the example, for the effort, for the determination, for the persistence in putting this all together as effectively as he has to the benefit of the people of all of Kentucky. A lot of other people are part of it too. Secretary Jim Gray, who you'll hear from in a minute, has had the unwelcome chore of making this work on a minute-by-minute basis. And here locally, we've had other people. Dr. Lynn Sadler from the Northern Kentucky District Health Department is here operationalizing this on the ground throughout all of Northern Kentucky in conjunction with her local partners, which includes our judges, our 3 county governments, many of our city governments, and of course St. Elizabeth Hospital. Covington is delighted to be an integral part of this team to help provide facilities like this, or the drive-through testing center that's located right behind us. But above all, we are very proud to be part of Team Kentucky as we work to mitigate the impact of this coronavirus. So thanks to all of you. Thank you, Governor. We appreciate your leadership.
I want to echo thanks to our judge executive right here in Kenton County. He would have been here last week when we wanted to do this, is traveling this week, has been very supportive of every step we've taken here, from testing to what we're doing right here today. Next, we have our Transportation Cabinet Secretary, Jim Gray, whose job has not only been to clear the roads so everybody can get here, but he's also taken on the secondary role of being our coordinator for our statewide vaccination projects. Jim?
Well, thanks, Governor. And I want to start out by thanking the Governor, just like the Mayor Meyer did, and others, for his leadership, for the persistence, for the determination. And speaking from someone who is in a role as a secretary in his cabinet, I'll thank him for the accountability that he holds us all to as well. That's a big deal, a big deal. It's also something really important. The governor will say about teamwork that there is no I in teamwork. And the work that I've had the opportunity to do just in the last few weeks means that I have been able to join a very high-performing team. The Cabinet for Health and Family Services, the Kentucky Department for Public Health, led by Secretary Friedlander and by Dr. Stack. Dr. Sadler, you know exactly who I'm talking about when I talk about well, we all know Dr. Stack because the evening shows with the governor and Dr. Stack, which we have all become very attached to because that's part of the hope that has been provided to us. The governor said earlier about this 11 months. 11 months, and it'll soon be 12, but 11 months since the first COVID case was identified in Kentucky. 11 weeks since the Pfizer vaccine was released. 10 weeks since the Moderna vaccine was released. And in that time, 555,000 Kentuckians have been vaccinated in arguably less than 10 weeks and 11 weeks, which is itself equivalent to a modern miracle. There's somebody else that I want to recognize that's on our team, and that's Kentucky Emergency Management Director Mike Dossett, because Mike has worked vigorously, and I know he's going to speak, but he has worked vigorously with our team And morning, noon, and night, we're on speed dial today. But I can tell you that working with Kroger, too, I don't know if Pelly Roberts is here. Is Pelly here? I don't know if she's here or not, but Pelly, Aaron Grant, that whole team has been really, really remarkable and extraordinary and great to work with. So I think I've said enough to say that it is extraordinary to be on a team where the work is so important. Do I get to introduce Director Michael Dossett of Kentucky Emergency Management, who wears many hats and wears them all well.
Good afternoon. Thank you, Governor, and thank you, Kroger Health, and Rodney from Kroger, and all of your clinicians and all of your staff for the continued support and partnership for Kentucky's COVID regional distribution efforts. If you tune into the broadcast, the Governor has featured Secretary Gray and I on a number of them, and we are so pleased to be finished with the storm and the remarkable efforts that the Governor put forth for the leadership, but in particular, Secretary Gray and his 2,000 folks out there on the roads day and night, or we wouldn't be here today, so thank you for that, sir. Just a few words to thank our partners and provide a brief look behind the scenes into the efforts and collaboration required of so many to bring a successful outcome. Kentucky Emergency Management is proud to lead the Unified Command Group for the Vaccine Administration Site Logistics Group. The Logistics Group is integrated as part of the Governor's Vaccine Task Force led by Secretary Jim Gray. We meet daily to develop planning initiatives and strategize for regional vaccine sites in order to reach the largest number of citizens throughout the Commonwealth and get them vaccinated certainly as quickly as possible. The group is tasked with reviewing regional site proposals, research of site capabilities to ensure smooth delivery, and survey of site visits. After those processes are completed, we recommend sites to the task force, and later we handle logistics for the setup. The logistics group is proud and also provided oversight for similar deliverables in 2020. The statewide mobile drive-through testing program. In that program, we conducted over 70,000 tests and developed the Kroger National Template for drive-through tests. And again, they use that across the country, and we're extremely proud to have been a partner. We're also fortunate to have many partnerships that support us from local, state, federal, and private sector agencies. Each state-sponsored regional distribution site typically consists of a team of over 50 personnel, all from partnering agencies. That is in addition to Kroger's staff. Thank you to our site host, the Northern Kentucky Convention Center. To our Kenton County partners, Judge Executive Chris Knockelman, Kenton County Homeland Security Emergency Management Director Steve Hensley, a good friend and colleague. Kenton County Sheriff's Office and the Kenton County Road Group. Also to our City of Covington partners, Mayor Joseph Meyer, thank you, sir. Covington Police Department and Fire Department, we thank all of you as well. And to Dr. Lynn Sadler in the Northern Kentucky Health Department. Our state and federal partners consist of KYM Incident Command, the Kentucky Department of Public Health, Kentucky Transportation, Kentucky State Police, and the Kentucky Army National Guard, the Board of Emergency Medical Services, and for FEMA. Again, thank you to our partners for their exceptional efforts, and to Governor Beshear for your leadership during this COVID crisis. We're all proud to be members of Team Kentucky.
Just thinking with that last crew, we've been through burning bridges and frozen roads in just a short period of time. Dr. Sadler, would you like to say a few words? Dr. Sadler has done an incredible job. If you want to know the pulse of a community, about how we're not just fighting this at a state level, but right here, about how we reach out to the most vulnerable, those that are difficult to reach, this is one of those individuals providing that leadership that we are so grateful for.
Well, thank you so much, Governor. I just have a couple notes here, and I had to write them down so I don't forget. Vaccinations have been occurring here in Northern Kentucky since the end of December, just before Christmas, starting off with a little partnership of St. Elizabeth Healthcare, the Health Department, and Health Point, our federally qualified health center here in Northern Kentucky. And so we are so glad to have Kroger's joining in the efforts as the governor builds out our vaccination infrastructure here in Northern Kentucky. So appreciative. In Northern Kentucky, almost 58,000 doses of vaccine have been administered thus far, which represents about 17% of the eligible population, ages 16 and over. And these are folks who have either had one or both doses so far. And so I need to wrap up with saying my moment of gratitude as well. I am so grateful for the leadership and the support of the governor, of the Cabinet for Health and Family Services, and Secretary Friedlander, Secretary Jim Gray, Dr. Stack, and the Kentucky Department for Public Health, Emergency Management, our elected officials, the support of our county emergency management and first responders, the fantastic partnership we have with the healthcare system, St. Elizabeth Healthcare and Health Point, my district and local boards of health, and my outstanding Northern Kentucky Health Department staff. You know, together, and when I say together, you have heard how intricate and what a massive operation this is. And as the governor said, at our level, we're operationalizing it with all of these partners, and it takes all of us at every level to make great things happen in our communities. And we are making forward progress in this pandemic, and we have a ways to go, but with ongoing new additional partners being added to our infrastructure, we will continue on full speed ahead until the day comes when the pandemic is drawn to a close and our communities are restored and have recovered. So I just want to thank the governor again for coming to visit here today, and I want to thank all of you who work with us at the health department on trying to bring this pandemic to an end. Thank you very much.
Let me finally recognize Dennis Keene, who heads the Department of Local Government, former state representative from right up here. We had committed that Northern Kentucky was going to be an important part of this administration, and if you want to talk about a job that each region would really like to have one of their own be the head of, Department for Local Government is one of those. We're happy to open it up to questions. We'll start. Yep.
Forward, the hours, how much throughput can you do on a daily basis, and what can you envision it being eventually? And then as a follow-up question, we were talking about this today. What is the pandemic and the weather and all of the other things you've had to deal with taken you away from? What did you want to do when you got to be governor that you're not getting to do because of all of this?
Yeah, as you can imagine, I thought I knew more about this job than most. My dad had been only one of two-term consecutive governors. But I tell you what, when you think you know something, God tends to let you know that you don't. Let me first start. This facility is incredible. It has the ability to do so much more. I think we're doing about 600 vaccinations a day right now. I think we could easily do 3,000. And I am excited about the point that we get there. Now, as we go, we'll have to scale up to provide the second doses too. And while we don't, our dashboard's all about first doses because we're trying to get down to specific individuals and who has some amount of immunity. But I think that 3,000 is easily doable here, if not more. Part of it will be how the federal government also provides to other groups, their pharmacy program, community health centers. But our goal is to ramp up these regional centers because of their efficiency. And we're really building for the future right now. We've got a facility downstairs that can already do more because we know we will have a lot more when it comes. We don't want to be like every state was when they shipped it on the first day but hadn't provided any money to build it out, which was behind schedule. We want to be ahead of schedule. So each of the last 6 weeks, we have provided more doses to people than the federal government has shipped to us. That's because we had some left over from the beginning. So our commitment is right here in Northern Kentucky. We want to be able to get, no matter how much they ship to us, we want to be able to get 90% of it in people's arms in that very first week. Moving back a little over a year, coming into this office, my goal was to create a better life for all of our families. And that's what we are doing here. It's something we have to get through and protect each and every one of them. But when we look at where we need to go in Kentucky, it boils down to a couple of really critical issues: the quality of education, the quality of our jobs, the quality of our health care, and then I think we need to see more ethical government, especially in Frankfort and throughout, more transparency. When you think about the quality of our jobs, we haven't stopped just because there's a pandemic. We announced about $2.5 billion of investment this last year. We've got a heck of an insurance company moving over here to Northern Kentucky that is going to be a flagship in this community. And this last year was, I believe, our second highest average wage for new jobs that we've ever announced. So for us, it's not just about jobs, it's about jobs that you can raise your family on, jobs that are truly meaningful and not just chasing a number. On the healthcare side, we've been pushed. We've been pushed by this pandemic, but I believe it's been some of our best work. When we go back to the summer, we were seeing what inequity in healthcare truly means. It's the difference between life and death. Our Black and African American populations were dying at twice the rate they make up of our population. We launched a 1-2-3 campaign to sign people up. We did specific advertising, and as we sit here today, that rate is normalized. It is back down to the rate and percentage of population. That's addressing inequity in real time, and it's something we got to continue to do. On the education side, boy, our educators have had to adapt, and they have been heroic in those efforts. But moving forward in the future, we got to provide the type of funding that our schools need. Yes, we've been able to provide CARES dollars so that we can have better technology, but we can't continue to underpay our teachers. We can't continue for college to get more and more expensive. We've got to make those types of investments that provide a better future for my kids and everybody else's. For me, it comes back to being a 43-year-old governor. I try to govern with urgency. I'm going to live in the economy and in the Kentucky that we helped build over these, I'm going to hope, 7 next years. And my kids are going to, too. Yes?
Governor, last week you said there were 5 cases of the variant
Yes.
in the state at the time, 4 of which here in Kenton County, NKY Health has said that they were related in somehow. Are those numbers still accurate? Have there been any more? And what concerns you right now about the spread?
So as of yesterday, we still had 5 confirmed cases, at least, that have been reported to me. Is that still accurate, Dr. Sadler? There you go. What concerns me about it is that this is the variant that spreads more aggressively, and we've got to assume that there's more out there than just that. These were the ones we identified in the sequencing. So that means we've got to continue to mask up. We can't let our guard down just because we have a great vaccination program going. It means that we need to vaccinate people as quickly as possible while they still maintain all the good practices. Now, we don't believe that this strain is more deadly, but if more people get the virus, more people ultimately have that ultimate negative outcome. Yes?
You had mentioned in your remarks about phase 1C. What's actually guiding that decision when you open up that eligibility? Is it getting enough of the 70-plus population? Is it strictly based on how much vaccine we're getting? What's guiding that choice?
It's a combination of the two, but we are looking very closely at what percentage of those 70 and older have been vaccinated. And then there's going to be a percentage of that population that we have to go to that will take a little bit longer. I think we can expect that regional centers like this will move to 1C. faster than some other groups that we can ask to be targeted, like our local health departments that know the hard-to-reach populations, those that have transportation issues. Just talking to the judge about, talking to the mayor about some equity programs where we can do the same thing. My belief is we'll be in 1C 1st of March, if not a little bit before, but that doesn't mean we won't have really targeted groups out there still making sure we can cater to 1B and asking folks like Kroger in this facility to prioritize them as they come in. We got some hesitancy, not a lot, in 70 and older. They've seen how deadly this virus can be, but it's really a soft hesitancy in that they want to see other people get the vaccine first, which is understandable, but we want to make sure there's a place, especially for those that suffer the worst outcomes, even if they choose to wait a little bit.
With phase 1C, I know part of it is folks who might be higher risk or
Yes.
that population. How are you deciding that? And then we've got some people specifically type 1 diabetes.
Yeah. Let's see. Phase 1C is determined. And I'll get a response from Dr. Stack on that piece. It's generally we're following the CDC guidelines, which I believe make that distinction as well. Dr. Sadler says I'm right. This is what Dr. Stack does to me when I'm doing one of these. And we've tried to follow those as closely as we can in 1C. I will say, and we try to be transparent, 1C is a really big group. And so when we open it up to 1C, we're going to need patients out there as well. And listen, this concept of essential workers is challenging on us too as a people, right? Isn't everybody essential? Don't we all believe we're essential? And trying to argue who's more essential than others, it's a real challenging concept. And so we're going to ask those in 1C, try to get your appointment. Know that we're going to have more and more appointments as we go. But when we open that up at large, it's going to feel like it's really hard to get one, but we're going to get to everybody. Yeah.
Are you concerned if more vaccine becomes available and eligibility becomes available that people will start to take advantage of it and vaccine sites will just start to run free and vaccinate whoever is coming in their doors? Is there going to be any regulations on that?
So we're working as best we can to make sure that we are vaccinating primarily people in the group that we're in. There's no question that some people either misrepresent age or other things. At the end of the day, we want to get everybody vaccinated. And so we ask everybody to do their best to follow the priority list, but that's one of two things we ask them. We ask, try to follow the priority list, but get at least 90% of everything you get in somebody's arm in that first 7 days. And if you have to dip down to get that done, especially as you get towards the end of the week, you're authorized to do that. And it's the two goals. We want to protect those that are most vulnerable as quickly as we can. We also want to get to herd immunity as quickly as we can. And so it's balancing those two together. Yeah.
What do you think the greatest room for improvement for what you guys are doing is right now?
The greatest room for improvement is equity. When we look at who is getting vaccinated, we need to do better with our minority communities, our Black and African American and our Hispanic communities. I think there are 3 reasons behind that. There is a programmatic reason, which we're working to address every day. There is a societal reason. When you look at the makeups of 1A in the workforce and part of 1B, we need a more diverse workforce there, and that's a longer term thing we have to work at, but we've got programs on each one going on in Kentucky. And the third is societal, is that our minority populations haven't been treated very well when it comes to vaccines in the past. And so it means we've got to be very intentional in building the type of community leadership that we need to ultimately get everyone vaccinated. We've been working very hard on that. The positive I can say is every community leader that's been asked has stepped up and has been excited to help. And then we've received offers to help, and we're saying yes to all of them. All of them. I think next week we've got a couple of NAACP events and others, and we're going to keep going. But that's the area that we definitely need to do better in. Yes, sir.
The pandemic has been going on since last March, and of course, we're seeing the light at the end of the tunnel with the vaccine side, like the one floor right below us. But with new variants on the way, once 5 confirmed cases already in this region, and a sizable portion of the population still not wanting to get vaccinated. How long do you see this pandemic lasting, not just in the state, but in the country?
Well, certainly my hope is that we will see significant relief this summer. And I think Dr. Fauci, who has a little bit better idea than I do about when some of these vaccines will be available, is now looking at June. Maybe we bleed a little into July when anybody who wants a vaccine can get one. The Johnson & Johnson vaccine is going to make a big difference once released. While it's going to trickle out, they haven't pre-produced as much as Moderna or Pfizer had. They've guaranteed 100 million doses by the end of June. For Kentucky, that's a little over 1 million, but that's 1 million people, right? There's no 2 doses. That's 1 million people that we can get vaccinated on top of everything else we have. Certainly, we believe that the vaccine works well against the UK strain. Against the South African strain, what we're all looking for is, can we stop the most serious disease and outcome? And they talk about it as a race. That's a race of production. I can tell you, you can look downstairs and we're ready to give every dose we get in. So for us, it's all about supply. But we want to get more and more efficient, because if we get that flood, we want to get it out fast.
Talking about how many people have been vaccinated in the state already. How many have received their second dose? How many have been fully vaccinated?
Let me get you that number. It is obviously it's less, and it takes a little bit longer. How we feel about the second dose is different than the metrics we have on the first. That second dose, every time we get it, is for a specific person. And if it takes us just a little bit longer to get it to them, we're willing to do that, because every second dose we are treating as a second dose and not turning into a first dose. That's the CDC and the FDA guidance, and we're following it pretty strictly. Yes? No.
You think this site can do 3,000 a day when we get that amount of vaccine? We've heard talk in other parts of the country about using NFL stadiums, larger stadiums. Northern Kentucky doesn't really have something like that. I mean, across the river they do, but are you looking at other sites here in Northern Kentucky for when we do maybe get more vaccine?
So at least as we see it now, between here and St. Elizabeth, everything the local health department is doing, our pharmacies and others, we believe that we've got the capacity to get out just about any amount that we get. This I got to tell you, for a state like Kentucky, can ramp up and by scale look pretty similar to what you'd see in other, much bigger places. And when you think about the fact that we have this here, but then we have similar facilities all over Kentucky, I think we're going to reach everybody and reach them pretty quickly. Federal government is also creating a lot of new programs, which overall is good. It sends in more vaccine. That federal pharmacy program doubling is 13,000 more Kentuckians that are going to get the vaccine. What we got to make sure is that we can coordinate and that we get the data so that we're not both trying to reach the same people. And actually, I got a good example from the mayor of that being done with one of the pharmacies from the federal pharmacy program. So that's really good news that we want to see. And then we need demographic data from it too. Because if we're talking about equity or age of those that we vaccinated, people care about how many people in Kentucky fit into those categories, not who did it.
Kentucky with the weather, getting the vaccine out, and then obviously I think Massachusetts governor specifically said he's thinking about sending the National Guard here where it's produced to get his doses because they're going to be delayed significantly.
Yeah, so there was a delay in the Moderna distribution. We think a lot of that is getting it out from the manufacturer. We had delays in our shipments, but when we look at what the weather did, it shut down pretty much one day across the Commonwealth here last week, one day in Frankfurt, but we've got the capacity to catch up. And we hate for people to be delayed by a week, but when we look at trying to get towards immunity, it doesn't slow down the timeline in that. We just double up the next week or double up the next week after that. Now, for people who are waiting for their shot, another week creates more anxiety. Yeah.
While you're here in Northern Kentucky, have you seen, or are you going to drive across the new fixed part of the Brisbane Bridge? And are there any new conversations happening right now on the Ohio side? What's the latest on that?
So I did drive over it on the way, and we made it. Let me first say to the Transportation Cabinet, to the Transportation Cabinet, great job. I mean, that was a crash of almost unimaginable proportions when you think about the heat that was there, and thank goodness no one was killed in that. But to come in under budget and ahead of schedule, to be able to attest to the structure itself, Jim, that was one heck of a job. The conversations on either permanent replacements or other opportunities continue, and they continue in earnest. Now, we do have news today about painting, though, right? You want to come give that news?
Well, for the first time in 29 years, I believe it's 29 years since if I'm doing my math right, Governor, 1991, it'll be 30 years. The Brent Spence will be painted, and there was a release that was sent out today that the painting contractor will commence preparation work on March the 1st. And yes, the bridge will be passable. And Stacy Hands is the project manager, and she knows all about this project. She was also on the bridge repair project, so you can be confident in that. All right, thanks.
All right, we'll take a couple more. Good.
Did you have anything to say about what Governor Beshear of Massachusetts said about possibly sending the National Guard here?
Well, we're getting it out, I believe, in UPS and Worldport. They have dealt with all types of issues, past and present, but remember, it has to get to a UPS plane to get to Louisville, to get out across the country. I am confident in their abilities. We, as a state, have invested in that airport in heated runways to make sure that they never shut down. We're going to make it. Again, in Kentucky, we can make up a delay very quickly. We hope other states are building out those same capabilities. Again, I want to thank all the partners that we have here. Thank you to our state representatives for being here and showing their support. And if you get a chance, just look at the faces of some of the people that are getting in to be vaccinated downstairs. There is hope. There is light at the end of the tunnel. I can't wait until we are here talking about something different in the future when we are beyond this pandemic. We're going to get through it, and we'll get through it together. Thank you all.